Can you share other cases of how patients that you've worked with have responded to neurofeedback? I'm also curious about whether you see neurofeedback impact some of the underlying sleep issues that often contribute to seizures.
When I see people in follow-up, I hear those changes, and it blows me away. Most recently, I saw a family. One of the impacting changes that I saw was their little girl who I followed for years. She had a stroke before birth and weakness on one side, has had some developmental issues. And they came in concerned because they'd seen a neurologist that said she's obviously having seizures because she was losing awareness. And they wanted to start seizure medicine, and they weren't against that. Dad's a healthcare provider himself. Mom's been involved in the healthcare field. Anyway, we did an EEG. She wasn't having seizures, but in doing her mapping, the brain analysis, it was clear there was other symptoms related to sleep, and they decided they wanted to work with neurofeedback with her. The dad, a healthcare provider who was, as he said, skeptical and believed this was all snake oil stuff, started noticing in just a few sessions, because no other interventions were happening with their daughter. And he called the office because she started talking with clarity and with fluency that she had never done with years of speech therapy.
Seizures can take a long time, but I have a number of cases that have taken much shorter amount of times, 20 sessions, 30 sessions,
Yes.
And people have actually gotten off of medications. Do you see seizure patients report other kinds of changes?
What I've seen in several of the patients that we work with neurofeedback who have seizures is their seizures can improve. That usually comes a little slower. What I often see sooner is their issues with sleep, dysregulated sleep. It's just not healthy, restorative sleep, which then spills over into the daytime of not being able to focus. And that accentuates the side effects of medications. Those things start to improve. So even before we see a difference with seizures, they start to experience improvements in those areas. That allows, in some cases, even a small decrease in a medication that might be causing side effects more than a benefit. One young man who just turned 13 comes to mind, and they've been coming for quite a while. Early on, and I followed him since he was 1 year of age when he was diagnosed with his first seizure, and he has what's called intractable epilepsy, uncontrolled, multiple medications haven't worked, dietary interventions, a surgical implant. He has a syndrome called Dravet syndrome, named after Charlotte Dravet. It's a really incapacitating type. They have multiple kinds of seizures. He was in the emergency room several times a month, required rescue medication for prolonged seizures of 10, 20, 30, 40 minutes, multiple times a month. And two things stick out with him that, as he was going through his course of neurofeedback, that surprised me, I think because I try to have high expectancy that this can help, but I try to be a realist. I mean, all around us, we hear, those are your seizures, you got epilepsy, you live with it, that's what you're going to have the rest of your life. When Mom made an observation 6-8 months into the process that he had not had Diastat as a rescue medication or been to the emergency room in 2 months, wow, that was huge. And that pattern has now continued over the last 2 years. The other thing is she came in one day and it sort of hit her that one of the types of seizures that he had are called myoclonic seizures. It's a sudden jump, a sudden jerk, and often that would cause him to just fall, hit the ground. And he was having hundreds of those myoclonic seizures a day. And after a few weeks, she came in one day and said, he has not had a myoclonic seizure. He was having hundreds a day. Two young men that we saw in their 20s both came for crippling anxiety. One was getting ready for med school, and these are very smart young men that came about a year apart, did their evaluations. They'd heard about neurofeedback. They heard what we were doing, did their mapping, did their training. Their lives were changed. One of the gentlemen never wanted to be on meds and was just white knuckling this in the most incredible ways that were just impacting his life. The other one was on several medications, but was just trying to get through life. And he tried breathing techniques and other things. And these two men, for example, their lives were dramatically changed. Their anxiety's gone. They got off their medications. The things that they could do. One's a musician and sing. He's now climbing up the charts with his latest album. Obviously, that may not be because of neurofeedback, but that was a huge part of him taking these steps. Having some families, some kids and others put together some testimonies has blown me away. And that's what keeps me going, is when I see people get better with what we're trying to provide through what we're doing here at Network Neurology.
With some very severe seizure disorders, it can take a lot of neurofeedback to have a big impact. There are clinicians who teach parents to use neurofeedback systems at home to do sessions almost daily for a while. Have you dealt with something like that?
There's a young lady in Spain who had horrible epilepsy, impacting, devastating her life as a top tennis player in her country, and on multiple medications, basically totally stopped her life. All the opinions that they were getting were telling mom, stop what you, just prepare for the next seizure, because the next seizure may be the last, meaning just get ready that this is going to kill her. There's nothing we can do. We could do some epilepsy surgeries, but her seizures came from different places. And mom, as a mom who cared about her child, who also happens to be a neuropsychologist, said, there has to be other options. This is all we're being told is this med, this med, this med, this med. And this mom went on a quest and learned neurofeedback. She trained, she understood neuromodulation. She went and researched the huge connection between our brains and our GI systems, and how our nutrition absolutely influences what's going on in our brains. And because neurofeedback wasn't readily available in the country they were in, that she started training and doing all this at home. And that's a huge commitment. That's a huge sacrifice. 450 neurofeedback sessions later, over the process of a couple years, pretty intensively, she is completely seizure-free. She's off all medications. She is interviewing. She's being recruited for colleges in this country. As a tennis player, she's one of the top-seeded young people her age, 16, in Europe. And that's been one of the most outstanding. And I don't think that's just a fluke.
I'd like to put that into perspective. 450 sessions over 2 years was done at home by the mom with her daughter. That means about 4 sessions a week for 2 years to really help stop life-threatening, intractable seizures. It's really not that much. And she took medications every day. So is she off the meds?
She is completely off meds. And yes, and again, another one of our paradigms is which I feel like is part of the matrix, we just accept if somebody has a problem, if I have a symptom, we get prescribed a medication or whatever, once a day, twice a day, and that's just what we're going to take. Once or twice a day for the rest of our lives. There might be a few side effects, kind of get used to it. And that's all just trying to manage. That's not healing anything.
Quick question.
Yes.
The seizure patients, because a lot of people are looking at this seizures, do you do a fairly high percentage of seizure patients when you offer neurofeedback? Are you doing neurofeedback as an adjunct modality with a fair percentage of your seizure patients? I'm just curious.
I have the privilege of seeing a lot of people with seizures and trying to help